Welcome back to the deep dive. Today, we are taking a deep breath and wading into the waters of early parenthood, specifically something called cradle cap. Now, clinically, the term is infantile seborrheic dermatitis. Doesn't exactly roll off the tongue, but for you, the new parent, it often just looks like your baby's scalp is getting covered in these greasy yellow kind of crusty patches. It's definitely not the picture-perfect baby head you might have imagined. So our mission today is to dive into your sources, really break down this common issue. We want to get into what actually causes it. The science is pretty interesting, and figure out safe ways to manage it at home. And maybe most importantly, figure out, when it's okay to just chill out about it and when you really do need to pick up the phone and call the doctor.
Right. And let's start with some good news, just to maybe lower the panic level a bit. Cradle cap is incredibly common, super common, and it's completely non-contagious. Your sources are showing like anywhere from 10 to even 70% of infants get this, usually in the first 3 months. The key thing, it's harmless. And almost always, it just goes away on its own, maybe 6 months, maybe 12 months, but it resolves. It's temporary.
Okay. Temporary is good, but yeah, visually it can be pretty intense. So let's unpack what it looks like. If you just see a few dry flakes, maybe that's just, regular baby dandruff.
Yeah.
What makes you say, okay, this is cradle cap?
Yeah, the visual is everything for diagnosis here. And the real giveaway is the texture, not just flakes. You're looking for thick patches. They can feel oily, sometimes waxy right on the scalp. The color is usually yellowish, maybe brownish, sometimes a bit grayish. But what really sets it apart is that these scales, they're kind of crusty and they stick tightly to the skin. They don't just brush off easily like dry flakes would. They often have this noticeable greasy sheen to them.
Greasy sheen.
And what's really interesting, or maybe reassuring, is how it looks versus how it feels for the baby. Despite looking quite dramatic sometimes, the condition is usually asymptomatic.
Yeah.
Meaning the baby isn't bothered by it. It doesn't typically cause itching or irritation or pain. You might see a little bit of redness right around the edges where the crusty part meets the healthy skin, but that's usually it. If your baby is scratching like crazy, you're probably looking at something else.
Right, that makes sense.
Yeah.
I think the look is just, it does throw you off.
Yeah.
It looks less like dry skin and more like, I don't know, melted candle wax or something. And we usually think of it just on the scalp, right? But your sources mention it can pop up elsewhere. Where else should parents be looking?
That's a great point. It follows the oil, essentially. So anywhere the skin is naturally a bit oilier or sebaceous, the scalp is definitely ground zero. But yeah, you can absolutely see it on the eyebrows where it really does look like bad dandruff. Sometimes on the eyelids, too. And very commonly behind the ears. Check those little folds.
Okay, behind the ears.
And also look in the deeper skin creases, like the neck folds, especially if you've got a wonderfully chubby baby where moisture and heat can get trapped. And yes, it can even show up in the diaper area, which is tricky because then it can easily be confused with a bad diaper rash or even infant eczema down there.
Ah, okay. So if the appearance is so distinctive, how does the doctor confirm it? Do they need to do tests, swabs, or anything?
Not usually, no. The diagnosis is typically very straightforward, made clinically. A pediatrician just looks at it. They recognize that classic scaly, oily appearance during a simple physical exam. So no special tests are needed unless, and this is the important caveat, unless it's really widespread, looks unusually severe, or if it looks like it might be infected, but typically, diagnosis by sight.
Okay, simple enough. Let's pivot then to the why. The causes, because this is where I think a lot of parents get it wrong, right? They see something on the skin and immediately think, oh no, I'm not washing enough, or it must be an allergy. So if it's not poor hygiene, what's the main driver here?
Right, and this is really the aha moment for understanding cradle cap. The single biggest driver is hormonal.
Hormonal.
In a baby, yep. Specifically, it's residual maternal hormones. Hormones from the mother cross the placenta during pregnancy, and they stick around in the baby's system for weeks, maybe even months after birth. And these leftover hormones, they act like a switch. They basically turn on the baby's own sebaceous glands, the oil glands.
Huh. So it's like a temporary mini puberty triggered by mom's hormones. That's kind of wild.
That's actually a pretty good analogy. It is kind of like that. This hormonal signal causes the baby's oil glands to just go into overdrive. They start producing way more sebum, or oil, than needed.
Okay, so too much oil. Then what?
Well, all that extra oil accumulates on the scalp, and it acts like this sticky glue. It traps the dead skin cells that are naturally shedding all the time, so instead of flaking off invisibly, these dead cells get stuck together by the oil, forming those thick, greasy, scaly patches we see.
Oil plus dead skin cells equals crusty patches.
Got it. Exactly. And then there's one more layer to it, biologically speaking. There's a type of yeast. It's called Malassezia. It's a normal resident on human skin. But this particular yeast just loves oily environments. It thrives in all that excess sebum.
Ooh, yeast.
Yeah, but it's important to know the yeast isn't the cause of the cradle cap. It's more like an opportunist. It feeds on the extra oil, and its presence can kind of exacerbate the scaling and maybe some of the mild inflammation. So you've got this perfect storm, maternal hormones kicking things off,
Yeah.
overactive oil glands, trapped skin cells, and then this yeast having a bit of a party in the oil.
Okay, so the yeast makes it worse,
Yeah.
but the root is still the hormones in the oil. That makes sense. Beyond that main hormonal cause, are there other things that might make one baby more prone to it than another, like secondary factors?
Yeah, there seem to be a couple of things. Genetics likely plays some role. If you have a family history of skin conditions like eczema or maybe psoriasis, the baby might have a slightly higher risk of developing cradle cap. And then there are environmental factors. Things that increase moisture or heat on the scalp could potentially make it a bit worse.
Like what?
Oh, like maybe keeping a hat on the baby indoors all the time, or if the room is kept overly warm. Anything that encourages more oil production or traps moisture could contribute a little, but the main driver is still those hormones.
Hormones.
Okay.
Got it. Okay, so if it's harmless and temporary, is it actually okay to just leave it alone? Like do nothing and just wait?
Yes, absolutely. It is okay to leave it alone. It really is a common harmless newborn thing that, almost always fades on its own schedule. However, even if you leave it, gentle hygiene is still a good idea. Not really to cure it faster, but more to prevent the buildup from getting super thick or reducing the chance of that secondary yeast or bacteria getting involved if the scales get really heavy.
Okay, so gentle washing is still good,
Yeah.
but for parents who do want to manage it, maybe the look bothers them or it seems really thick. Your sources mentioned a clear, like, three-step approach.
Yeah.
But hang on, why are we using oil to treat an oily condition? Doesn't that seem backward?
Huh. Yes, that's a brilliant question, and it always comes up. It sounds totally counterintuitive, doesn't it? But the key is how you use the oil. You're using it to soften, not to add more oiliness long term. Think of the oil you apply, whether it's, plain mineral oil, baby oil, coconut oil, even olive oil. Think of it like a solvent. It works its way into those thick, hardened, crusty patches. It softens the sticky sebum that's holding all those dead skin cells together. It loosens the glue.
Ah, okay. So it's like pre-treating the scales to make them easier to remove.
Precisely. So the process, based on the sources, generally looks like this. Step 1 is softening. You apply the oil directly to the scaly patches. Leave it on for about 10 to 15 minutes before you give the baby a bath. This is really key for stubborn scales.
Okay, oil first, then wash.
Yep. Step 2 is washing. Gently wash the baby's scalp. Maybe 2 or 3 times a week is usually enough. Use a mild, tear-free baby shampoo. This helps wash away the loosened scales and the excess oil you applied. And then step 3 is gentle removal. After the softening and the shampooing, while the scalp is still damp, you can use a very soft bristled baby brush, or maybe one of those fine-toothed combs that sometimes come in baby kits. And you just gently brush or comb the area to help lift away the flakes that have been softened.
Okay, I need to jump in on that word gently because this feels like where things could go wrong. We should absolutely not be picking at these scales, right?
Oh, absolutely crucial point, yes. Please do not pick or scrape at the scales with your fingernails. And don't brush too hard or use a stiff brush. If you're too forceful, you can easily irritate the underlying skin, cause swelling, or even create little breaks in the skin barrier.
Which opens the door for infection.
Exactly. So gentle, gentle, gentle is the mantra. And one more really vital step. After you do the oil and shampoo, make sure you rinse really thoroughly. You don't want any oil residue left behind because that could potentially trap more dirt or oil and kind of defeat the purpose.
Right. Rinse well. Got it. Okay, so earlier you mentioned cradle cap can sometimes be confused with other things, especially if it shows up off the scalp. How do we clearly tell the difference between this and, say, infant eczema? They can both look kind of scaly and red sometimes.
Yeah, they can look similar sometimes as sort of like skin condition cousins, but there are key differences. Think of cradle cap, seborrheic dermatitis, as typically oily or greasy. The scales are often yellowish or brownish. And critically, it's usually not ishy. Asymptomatic, remember? It tends to show up really early in the first few weeks or months and likes those oily areas, scalp, eyebrows, behind ears.
Okay, oily, yellow-brown, not itchy, early onset, oily zones. What about eczema?
Eczema, or atopic dermatitis, is usually the opposite in many ways. It tends to look red, dry, and inflamed. And the big one It's typically very itchy. The baby will often be trying to scratch or rub the affected areas. You'll see that discomfort. Eczema also often appears a bit later, not always right at birth, and it favors different spots, often the cheeks, the crooks of the elbows, behind the knees, and it's more closely linked to dry skin, allergies, and external triggers.
Itchy is the big clue then. If the baby is scratching, lean towards eczema or something else.
That's often a very helpful differentiator, yes.
Okay, good to know.
Yeah.
So let's put a pin in this.
Yeah.
When does this common harmless thing cross the line? When does it stop being a manage-at-home issue and become a call-the-doctor issue?
Right, the red flags. There are basically four main scenarios where you should definitely get your pediatrician involved. First, if the condition starts spreading really significantly beyond those typical areas, like if it's starting to cover large parts of the baby's body and doesn't seem to be responding to your gentle home care.
Okay, widespread spreading. What else?
Second, if the area looks infected. Signs of infection would be severe redness, puffiness, if the skin feels hot to the touch, if it's leaking pus or fluid, or if there's significant bleeding or really thick crusting that looks angry.
Infection signs: red, puffy, hot, pus, bleeding. Got it.
Third, if your consistent home care, the gentle washing, the oil softening just isn't making any difference after, say, a few weeks. If it's staying exactly the same or getting worse despite your efforts.
No improvement after a few weeks.
Okay.
And the last one.
And fourth, goes back to what we just discussed. If the baby seems clearly uncomfortable, if they're really fussy, constantly trying to scratch at their scalp, that suggests significant itching. And as we said, typical cradle cap isn't itchy, so intense itching means it might be something else, or it's become severely irritated and needs a doctor's assessment.
So basically, spreading badly, looks infected, isn't getting better with home care, or the baby is obviously itchy and uncomfortable.
Exactly, and in those cases, the doctor might prescribe something stronger, like a medicated shampoo, maybe with salicylic acid or zinc, or sometimes a topical antifungal, or even a mild steroid cream if there's a lot of inflammation or suspected infection.
Okay, that's a clear checklist.
Mhm.
Moving on, your source material also touched on how specific products are often designed to tackle cradle cap, hitting those management points we discussed. Softening, cleansing, soothing.
Right. The product strategies really just mirror the understanding of the condition. They aim to address the underlying issues we talked about. So, you see goal 1, softening and hydration. The problem starts with those hardened, stuck-on scales, right? So you need something to loosen them up. Products like natural baby balms often use ingredients like organic sunflower oil, maybe coconut oil or beeswax. The focus is on deeply moisturizing to penetrate and soften those scales, making them easier to gently brush away without force. And they tend to use gentle, often organic components because baby skin is so delicate and that skin barrier is still developing.
Makes sense. Soften the crusts. And then since you mentioned that Malassezia yeast and potential irritation, what about calming the skin down?
That's goal 2, soothing and anti-inflammatory. Because the trap cells, and sometimes that yeast can cause a bit of redness or mild inflammation, products will include ingredients specifically chosen to calm things down. A really common one is organic calendula extract. It's well known for its anti-inflammatory and skin healing properties, so that helps reduce any redness you might see around the edges of the patches.
Okay, calendula for calming. And the third angle?
Goal 3 is barrier support. This is all about helping the underlying skin heal and protecting it while it recovers. So you'll find specialized dermatitis creams, for example, that might contain things like aloe vera, chamomile, maybe shea butter. The idea here is twofold. Reduce any lingering irritation, but also form a sort of protective layer or barrier on the skin. This helps prevent moisture loss and shields the healing skin from potential irritants, which ideally supports a quicker recovery as those baby hormones finally start to settle down.
So it really maps perfectly onto the strategy. You gently cleanse away the excess oil, you soften the crusts so you can gently remove the buildup, and then you soothe and protect the skin underneath while the whole hormonal thing runs its course.
Precisely. It's a logical approach based on the cause and presentation.
Okay, this has been super helpful. Let's try to boil it down. Key takeaways for you listening. Cradle cap. Super common. It's temporary. It's driven by those leftover maternal hormones causing extra oil. Crucially, it doesn't hurt or itch usually. And your best bet for managing it safely at home is simple, gentle, consistent washing, combined with using oil beforehand to soften any thick scales before you gently brush them away. Patience and gentleness are really the name of the game here.
Exactly right. And if we connect that back to the bigger picture, the ultimate resolution of cradle cap really just depends on the baby's own system stabilizing. The whole issue fades away as those maternal hormones finally clear out, allowing the baby's oil glands to calm down and regulate themselves naturally. It's a waiting game, fundamentally.
Which leads to a final thought.
Well, yeah, since we now know these residual maternal hormones have such a potent, albeit temporary, effect on a newborn's oil glands, leading to this very visible, sometimes alarming skin condition, it kind of makes you wonder, doesn't it? Considering this profound hormonal influence, what other common, seemingly mysterious, but ultimately temporary newborn conditions might also be linked to mom's hormones hanging around for a while, only to vanish as the baby matures? Something for you to perhaps mull over on your own knowledge journey.